Welcome to This Explainer. I'm speaking to you today on behalf of the medical education team over at Westminster Multispecialty Clinic, located right in the heart of Dubai Healthcare City. We're going to dive straight in today because we're tackling something we see all the time, a remarkably common, but honestly entirely misunderstood experience. We're looking at that quiet, unexplained loss of forward pull that so many high-achieving adults suddenly face. You know exactly what I mean, right? The projects you used to care about, your weekend plans, they just stop pulling you forward. It's a silent shift, and man, it can be deeply unsettling. So let's map out exactly what's going on in the brain and body when this actually happens. Have I just gotten lazy? We're holding a mirror up right away because at Westminster Multispecialty Clinic, this is literally the exact question we see high-performing professionals asking themselves every single day. When their motivation suddenly falls off a cliff, they look inward. They assume they've just lost their edge. They tell themselves, well, I just need to push harder, sleep a little less, and, just want it more. But here is the absolute crucial takeaway. That self-diagnosis, it's almost always wrong. And even worse, trying to just push through it almost always makes things significantly worse.
It's so easy to fall into the trap of that self-diagnosis, isn't it? That whole societal myth of laziness. It feels like a character flaw, a total lack of willpower, or some moral failing that just requires stricter discipline. But the medical reality, what our psychiatry team actually sees day in and day out, is a whole different story. Low motivation is actually a neurological symptom. It is the direct result of a dysregulated reward system. Now sure, sometimes you're just tired and a good night's sleep will fix it. But when sleep doesn't fix it, we're talking about biology here, absolutely not a moral failing.
Section 1. Understanding functional depression.
When most people think of depression, they picture someone crying in the dark, unable to get out of bed. But at our clinic, we frequently see patients whose depression is, well, entirely functional. Take a mid-level manager, for example. They might perfectly execute a massive quarterly review, but feel absolutely nothing when it's done. You're still showing up. You're hitting your deadlines. You're answering your emails. From the outside, you look completely fine to everyone around you, but internally, you're running on empty. The output is there, but your internal engagement with your own life has just gone completely flat.
There's a medical term for what you're losing here, hedonic tone. Basically, this is your baseline capacity to find things rewarding. You see, motivation isn't a personality trait. It's actually just your brain's reward system doing its job. So when that system gets dysregulated, your hedonic tone drops, and your motivation, it just disappears right along with it. No amount of self-discipline or forcing yourself to grind harder is going to magically manufacture a chemical reward that your brain simply can't produce right now. Section 2. The Dubai Hustle Factor.
Let's talk about the environment we're in, because our city runs on output, on highly visible success, and on looking like you have it all together all the time. In this intense, high-achieving expat culture, admitting to low motivation, it feels like confessing a weakness that literally no one else has. So what ends up happening? Our patients mask their symptoms out of pure shame. The professional stakes and deadlines are so real that they just use the sheer force of professional obligation to keep the wheels turning. By the time they finally walk through our doors at Westminster Multispecialty Clinic, they've often been managing this quietly and entirely alone for months, sometimes even years.
Section 3. The hidden culprits of low motivation. It's not always depression, though. The first pairing that absolutely nobody expects is anxiety and low motivation. We usually picture anxious people as hyperactive or visibly wound up, right? But chronic anxiety is exhausting. Your body is running a low-level stress response for hours every day, and your mind is constantly spinning through worst-case scenarios. That perpetually drains your mental availability. It's like the executive who spends 3 hours stressing over the tone of one single email, leaving them way too exhausted to start the actual project. Over time, that leads to severe depletion. An anxious person often looks flat, avoidant, and unmotivated, simply because their cognitive tank is completely empty. Then we have stress and burnout. And I want to be very clear here. Burnout isn't just being tired. It's a very specific type of exhaustion that happens after sustained emotional and cognitive demand without any real recovery. That motivational flatness you feel when you're burned out, that is actually your nervous system doing exactly what it was designed to do, conserve resources. It's not laziness. It is a biological imperative telling your body to slow down.
Another totally misunderstood culprit is undiagnosed adult ADHD. Honestly, this is one of the most commonly missed causes of motivational difficulty that we see at the clinic. An adult with undiagnosed ADHD has often spent decades thinking their struggle to sustain attention is just a personal failing. They build up these incredibly exhausting workarounds just to function. But what they really need isn't more willpower, it's a clinical explanation and proper treatment for a real neurological difference.
Finally, we have somatic symptoms. This is where your emotional distress actually expresses itself physically. Think deep, unexplainable fatigue, mysterious aches, or just a heavy feeling in your limbs. People dealing with this will often spend a ton of time bouncing around looking for a physical cure long before anyone stops to ask about the psychological root. Your body is quite literally carrying the physical weight of unaddressed emotional distress.
Section 4. When to take low motivation seriously.
So how do you actually know when it's serious? Well, think about these signs. Has this slump lasted more than 2 or 3 weeks without any obvious cause? Are you dealing with severe sleep changes, like sleeping way too much or lying awake totally exhausted? Do tiny decisions like what to grab for lunch suddenly feel completely impossible? Have you lost the joy in food, your hobbies, or hanging out with friends? And maybe the biggest one, do you just feel like you're getting through life counting down the hours with this background sense that you aren't really present? If you're checking these boxes, it is absolutely time to take this seriously.
Section 5. Why proper assessment matters. The completely wrong approach here is guessing, trying to self-diagnose, and sitting around feeling ashamed. Why? Because depression, anxiety, burnout, and ADHD all look nearly identical from the outside. They all cause low motivation. But here's the kicker. They require completely different medical treatments. Depression might need medication or therapy. Burnout requires very structured rest. ADHD needs targeted neurological treatment. Guessing is almost always going to fail you. The right approach is a targeted clinical assessment so we can get the actual correct clinical picture.
So, what does a proper assessment actually look like? At Westminster Multispecialty Clinic, we really want to demystify this whole process. Coming to see our psychiatry specialists is just a logical, proactive health decision. First, we just start with a conversation, no jumping to conclusions. Second, we do a comprehensive evaluation of your sleep, your mood, your energy, and your cognitive function. Third, and we find this so important, we factor in your specific life context. The pressures of expat life in Dubai, the relentless pace, the isolation, the performance demands, it all really matters. And finally, step 4, we determine the exact right treatment pathway for your specific biology and lifestyle. So I'll leave you with this. If it isn't laziness, how much longer are you going to wait to treat it? If what you've been calling laziness has been lingering long enough for you to start wondering about it, that wondering is worth following up on. Seeing a medical professional for this is the exact same logic you'd apply to a physical symptom that just won't go away. You wouldn't call yourself weak for having a persistent cough, you'd go find out what it is. We really invite you to reach out to our supportive team at Westminster Multispecialty Clinic in Dubai, Healthcare City. Let a proper assessment do what self-diagnosis simply cannot. Thanks for joining me for this explainer, and we really look forward to helping you regain your forward pull.